When we created our 2020 strategic impact goal, we made the commitment that we would focus on improving the cardiovascular health of all Americans. For decades, the American Heart Association has been focused on all Americans, but we recognize, especially as we entered this new decade, that the disparities in healthcare, the disparities in health status are very alarming. And so we are committed as an association to focus our efforts on improving the health of every single American in this country. And our 2020 goal will drive us to make that happen. In 2012, the Board of Directors approved a health equity business plan that calls out very specific strategies for the association to focus on our populations who need the American Heart Association's programs and services most. For example, we will be focused on blood pressure control in the African American population. We'll take our very successful program Check It, Change It, which we piloted in Raleigh-Durham, North Carolina, and we'll work in 20 target communities in this country to look at that resource and other resources of the AHA to determine how best to adapt that to help lower blood pressure in those communities. And through our partnership with the Council on La Raza, we will be focusing in our Hispanic and Latino communities on obesity, nutrition, and type 2 diabetes. And so these are just two ways that the American Heart Association is focused on improving the cardiovascular health of all Americans. We have already demonstrated that our programs make a difference in the lives of all Americans. For example, we've published 190 peer-reviewed publications in Get With the Guidelines, and many of them demonstrate that care delivered at hospitals using our Get With the Guidelines program helps reduce and in some cases eliminate healthcare disparities. These are important activities of the American Heart Association that truly will make a difference in improving health status of all Americans.